Collagen supplements are advertised to help reduce joint pain, improve stiffness, and slow down the progression of arthritis. But what's the evidence behind these claims, and do they actually work? Let's look at what some recent clinical trials say. Hey everyone, Dr. Jeff Peng here. Collagen is a type of protein that is naturally found in the body and is a key component of cartilage. And cartilage is what helps pad and protect our bones. Osteoarthritis, by definition, is caused by the loss of articular cartilage. The theory is that taking collagen supplements can help increase the body's natural production of collagen. This in turn can help improve the strength and elasticity of the cartilage in the body, which hopefully leads to less wear and tear and less arthritis. So that's the science behind how collagen supplements might help, but now the question is, does it actually work? Let's take a look at the results of a few recent clinical trials. The first study was published in April of 2022. It is a randomized controlled trial aimed to evaluate the impact of type 2 collagen on knee osteoarthritis in individuals 60 to 80 years old. Participants were randomized to either 40 milligrams of type 2 collagen or a control group. Both groups then underwent a standard physical therapy treatment. The results showed a significant improvement in visual analog pain score in the collagen group. They went from a baseline score of 7 out of 10 down to a score of 3. The control group scores went from 7 down to 6. There was also a significant improvement in the total WOMAC score, which is an osteoarthritis index score. This is usually scaled from 0 to 96, with 96 being the worst score. The collagen group had a significant improvement from 54 down to 44, while the control group went from 58 to only 57. The authors go on to conclude that incorporating type 2 collagen into a treatment regimen improved pain, reduced joint stiffness, and improved physical health components of quality of life after 90 days of use. At first glance, these results look impressive, but one of my biggest critiques of this study is that no placebo was used in the control group. In fact, this is actually a big red flag. Placebos are necessary to help control for the placebo effect, which is a phenomenon in which a person's symptoms can improve simply because they expect or believe that they are receiving treatment. This is critically important in a randomized controlled trial because the goal is to determine the true effect of a treatment being tested, independent of any placebo effect. So we are now left to wonder if the improvements in pain scores and WOMAC scores are actually due to collagen or if they are due to the placebo effect. So what we really need is a randomized controlled trial that includes a placebo group, and that's what this study did. It was a 3-month randomized controlled trial comparing 40 milligrams of undenatured type 2 collagen, glucosamine and chondroitin dosed at 1500 milligrams and 1200 milligrams respectively, and placebo. The results showed that type 2 collagen reduced pain, stiffness, and physical function associated with osteoarthritis compared to baseline and compared to placebo. In addition, WOMAC osteoarthritis scores for the type 2 collagen group were found to be similar to the glucosamine and chondroitin group. Both groups improved by around 33 points. This is significantly more when compared to the 14-point improvement in the placebo group. The authors go on to conclude that type 2 collagen is considerably effective in improving the overall symptoms of osteoarthritis, and that the effects are comparable to that of glucosamine and chondroitin. Now, while this was a very well done study that showed pretty impressive results, the big limitation of the trial is that they had a very small sample size with only 30 or so patients in each group. So now what we need is a larger sample size, and that's when we look to systematic reviews and meta-analyses. Unfortunately, I was only able to find one systematic review and meta-analysis listed on PubMed in the last 15 years for the use of collagen supplementation in arthritis. This study was published in March of 2019 and aggregated data from 5 randomized controlled trials for a total of 519 subjects. All of these studies compared collagen treatment to placebo. The results showed that collagen gave a significant reduction in the score of the total WOMAC index by 8 points when compared to placebo. There was also a significant reduction in the visual analog pain score after collagen administration. The authors go on to conclude that collagen is effective for the treatment of improving osteoarthritis symptoms. By the way, if you're finding this information useful so far, please click the like button. It will help the video spread to more people and help them too. Thanks for doing that. So if we just took a brief look at the conclusions of these clinical studies, we may think collagen supplementation will work tremendously in reducing symptoms related to knee osteoarthritis. But let me tell you why I still have my doubts and why I am not currently recommending collagen supplementation specifically for the treatment of joint pain and arthritis. The first is that there is currently only one systematic review and meta-analysis looking at the use of collagen for joint pain. The studies were all heterogeneous and used both hydrolyzed collagen as well as undenatured collagen. Dosing was also all over the place. To make things worse, every single one of the studies included in the meta-analysis was funded by industry or pharmaceutical companies, and they have a clear motive to report favorable results. Let's contrast this to other common supplements. The most studied is glucosamine and chondroitin. A recent systematic review and meta-analysis included 8 randomized controlled trials for a total of almost 3,800 patients. They concluded that combination glucosamine and chondroitin showed a significant advantage against placebo in the total WOMAC osteoarthritis score. They too had some studies funded by industry, but also many that were not. The other supplement which has shown tremendous beneficial effects is turmeric and curcumin. These two had a recent systematic review and meta-analysis which included 15 randomized controlled trials for almost 1,700 patients. They concluded that curcuminoids can be expected to achieve considerable analgesic and functional promotion effects for patients with symptomatic knee osteoarthritis. Other systematic reviews suggest that turmeric supplements have a rather large effect size and could be on par with taking powerful anti-inflammatory medications such as ibuprofen and naproxen. Again, some of these studies were funded by industry, but many were not. So I want to be clear. I'm not saying collagen supplements don't work. They might, but I just don't think there is sufficient data right now to widely recommend them. If you're interested in taking supplements, I would recommend looking at options that have been more widely studied and seem to have more evidence for their use. Both glucosamine and chondroitin, as well as turmeric and curcumin, have been much more extensively studied than collagen. Turmeric specifically may also have a much larger effect size in reducing symptoms. So because all of this, I wouldn't recommend collagen at this time until more robust studies are done. And if you're interested in learning more about glucosamine, chondroitin, or turmeric and curcumin, check out one of these videos next. Thanks for watching.